Bill Gates and many others like him, but Bill Gates in particular, has for some time been talking about saving babies. And in fact, this is a common concept of saving babies. Now, this is a misunderstanding of human biology. And the gravity of this misunderstanding is that during the late 60s and early 70s, there was a big push to reduce perinatal mortality.
I remember.
And it was to a significant degree successful. And then Peter Farrow from Liverpool thought the way that you and I are thinking. And he looked at the data. And what he saw was that the prevalence of cerebral palsy during the period of best reduction of perinatal mortality, the prevalence of cerebral palsy amongst low birth weight infants had risen threefold.
My goodness.
And this, it was not just Peter Farrow, but Karen Nelson at the National Institutes of Health in the United States of America, and Fiona Stanley in Perth, Western Australia, reported independently exactly the same data. And what they were doing, of course, was saving babies that otherwise would have died. And the key to the successful health of a child being born is the mother and its maternal health and nutrition even prior to conception.
Yeah.
And saving babies at the other end of the story, it's like closing the stable door after the horse has bolted.
Indeed, or having the ambulance at the bottom of the cliff instead of building a fence at the top of the cliff. That's right.
Yeah, it's extraordinary how the mother has been neglected.
Well, this reminds me, Michael, of, and they used a title, it was, I think, one of the Caroline Walker Trust lectures, "A Nation Cannot Rise Above the Level of Its Women."
Peggy Wynne.
Michael, it's wonderful talking to you. You have you know the details. Thank you. Now, would you want to expand a little on this? Because, as you say, it gets ignored, doesn't it?
The real problem, of course, is that we're facing a crisis of brain health. That was, for the first time, publicly announced by the Federation of European Neuroscientists, Brain Awareness Week in March this year, when they said that brain health conditions was now a global crisis. And the answer to this is maternal health, nutrition during the pregnancy, before and after, of course.
Has there been, do you think, any recognition that we need to do better with maternal nutrition and preparation for pregnancy?
Well, absolutely. I mean, I think the interesting thing is when we had a conference, an international conference, the Royal Society of Medicine, back in 1993, it was to celebrate the opening of the Mother and Child Foundation. Mark Belsey, who was director of maternal and child health in Geneva at WHO, came and gave a talk. And in his talk, he talked about the Bill Gates approach. He said, you know, wherever you look, the interest of the child is served. So you have UNICEF, you have Save the Children Fund, the ubiquitous institutes of child health everywhere. And then he paused and he said, but there is no voice for the mother. There is no voice for the mother. And that's true still today, as it was then in the 1990s. And Bill Gates' example of pouring tons of money into saving babies is a good example, confirmation of this subject.